Hey everyone, in this video I'll be discussing the interaction between Lamotrigine, which is also known as Lamictal, and oral contraceptive pills. For some quick background, Lamotrigine, which is known by the brand name Lamictal, has FDA indications that include bipolar disorder and epilepsy. Lamotrigine is used off-label for a lot of different conditions including migraines, OCD, PTSD, major depressive disorder, and more. It works by inhibiting the release of excitatory neurotransmitters by blocking voltage-gated sodium channels, and some major side effects include but aren't limited to Stevens-Johnson syndrome, TEN, and GI side effects. So when considering lamotrigine and oral contraceptive pills, it's important to be aware that estrogen and oral contraceptives can decrease lamotrigine levels by more than 50%. This is able to occur because lamotrigine is eliminated via a process called glucuronidation. Estrogen from the oral contraceptive will actually increase the activity of the enzyme responsible for glucuronidation. This enzyme is known as uridine diphosphate glucuronylyl transferase, or UGT. So the estrogen that's in these OCPs will increase the activity of UGT, which means that lamotrigine is being increasingly metabolized, which means that there will be decreased levels of that lamotrigine. So for patients who are on lamotrigine, there's kind of two main considerations, and the first of which is actually starting OCPs. So we said once you start OCPs, you get increased lamotrigine metabolism because of that increased glucuronidation occurring. This means you'll have decreased lamotrigine levels. As a result, if a patient is on lamotrigine for seizures or if they're on it for mood stability, they will find themselves at increased risk of seizures or mood instability. So some key considerations when it comes to starting OCPs while on lamotrigine, you want to be sure to obtain a baseline lamotrigine level. Once you actually start the OCPs, you may need to increase the lamotrigine because the OCPs may be decreasing the level of lamotrigine. So slowly you could potentially increase that lamotrigine. And then it's also important to check lamotrigine levels after the OCPs have been initiated. On the other hand, if a patient is on OCPs and lamotrigine together and they decide to stop taking those OCPs, they will actually have decreased lamotrigine metabolism because the enzyme that was being induced by the OCPs isn't working as much anymore. Because of that, we have decreased lamotrigine metabolism, which means we have more lamotrigine plasma levels. And because we have more lamotrigine levels than we're used to, we could be at risk of toxicity because of that lamotrigine. And because of this increased risk, you want to be prepared to decrease the dose of the lamotrigine. Just a final thought. Generally speaking, these effects relate solely to estrogen-containing oral contraceptives. Progestin-only contraceptives do not have this effect and shouldn't affect lamotrigine to any significant degree. Thank you so much for watching. If you have any questions, please feel free to leave them below.